My name's Nick Ward. I'm a consultant neurologist here at the hospital, but I'm also a PI in the Sobel Department of Motor Neuroscience. My area of interest is clinically stroke, and I use various brain imaging techniques to understand mechanisms of recovery after stroke. So the big question that I'm interested in is trying to understand the mechanisms of recovery of movement after stroke, and secondly, how we can interact with those mechanisms in order to try and improve how stroke survivors recover. Well, stroke is the largest cause of physical disability in the world. Recovery of arm function is something that is often neglected in rehabilitation programs, but actually recovery of arm function is a major contributor to quality of life after stroke. So it's a big problem, and if we can work out what the mechanisms of recovery are, enhance some of the ways that we try and treat people, it should have a major impact on a very large group of people. So in the research that we've done so far, we generally use structural and functional brain imaging to try and understand mechanisms of recovery, particularly of arm function after stroke. One of the key things that we started off with 10 years ago was trying to understand the variability of how people recover, because outcomes after stroke are quite variable, and the likelihood is that that's due to the difference in the anatomy of the damage. So in other words, the residual structural networks and the residual functional networks in the brain are completely different in different patients. So the imaging work that we've particularly done over the last 10 years has really demonstrated that variability both in structure and function in terms of what's left that can support recovery in individual patients. But not only that it's variable in quite a predictable way, which makes it useful to us. So the goals of where we're going with this work are really to try and understand how we might deliver particular treatments to particular patients. So the reason that is an issue is because outcomes in patients are different. The reasons they're different, as I said before, are to do with the fact that the anatomy of the damage is different, and the way an individual patient's brain is organised is different. Now, most of the treatments, the novel treatments that neuroscience is bringing along, such as drugs and non-invasive brain stimulation, they're going to interact with those residual functional networks in individual patients. So unless you understand the mechanism of action of the treatment on the one hand and how this person's brain is organised, you're not really going to be able to get a handle on whether those two things will combine and whether the treatment will work in an individual. So we're really after ways of predicting whether an intervention will work in an individual, because that will allow us to design clinical trials in a much more efficient way. So one of the problems that we've got in understanding the mechanisms of action of interventions is that we'll need to address there's a problematic gap in our understanding between what we know at the level of cells and molecules and what we know about recovery from the point of view of behaviour. So in other words, animal studies and human studies. And some of the imaging techniques that are coming along at the moment are going to allow us to fill that gap. We're going to be able to study mechanisms of interventions in the human brain at a range of scales of brain architecture, from large-scale networks down to small interactions within the cortex in humans in vivo, which is very exciting.